Good afternoon and welcome to our free Nursing Times webinar on listening to, supporting and protecting nurses. I'm delighted that you can join us for this event, which is supported by an educational grant from Vocera. My name is Steve Ford and I'm the editor of Nursing Times. My guest today is Dr. Rhonda Collins, who's the Chief Nursing Officer of Vocera Communications. For the past 2 years, she has authored a report on the challenges and stresses facing the nursing workforce, with resonance for members of the profession around the globe. Coming as it does during the ongoing pandemic, her Vocera 2021 CNA report is titled Protect the Nurse, Protect the Practice, which I suspect is something we can all relate to and fundamentally agree with. Today, we'll be exploring a range of linked themes. These include staff burnout and addressing the work environment, keeping nurses protected and safe, empowering nurses with control over patient-family communication, reducing the stress of crisis care, enabling smooth movement of decision-making from junior to senior staff and back again, protecting nurses from workplace violence, and measuring and solving communication task loads. In a moment, I'm going to invite Rhonda to talk about her report in more detail, and after that we will have time for questions and comments from you, our audience. So please post them in the chat function and I'll ask them on your behalf. Also, we'll be asking you, the audience, again, several poll style questions during the presentation, as we want you to feel engaged and involved. So to take part, when prompted, please post your answer to the poll question being asked in the question box so we can see the most popular and let you know the feedback from that. So that's enough from me. Over to Dr. Collins.
Thank you, Steve. It's great to be with you again. I think this is maybe our second or third webinar together. So I'm looking forward to this conversation. Thank you for this opportunity again. Okay, if we'll just transition to the slides, we'll go ahead and get started. Next slide. As we know, even before COVID, nurses have really had a difficult time. It's been chaotic for sure over the last 17 to 18 months. We have had many challenges that we're facing over and over. It has become even more critical. I tell this story. I was a volunteer vaccinator in my community, vaccinating for COVID. And a young nurse was on my team at the COVID-19 vaccination clinic where I was working. And she had been hired right out of a prestigious nursing school to work in an ICU in a local hospital. And as she was working with me that day, we started talking about the work and what it was like. And she said to me, she said, well, I left that job. And then with tears in her eyes, she looked at me and she said, I will never go back. I will never work in a hospital again. And I was very distressed by her response because it was clearly very emotional for her. And so as we worked through the day, I was able to ask her some questions, and I asked her, I said, what happened that made you feel this way? Because clearly you have been brilliantly educated and you're very qualified, and right now what you're doing is far below your capabilities and skills. And she said, I was on an island. As soon as I put on my PPE and went in to care for the patient, I felt cut off. Even experienced nurses, she said, were cut off from being able to ask questions and get supplies and really have the responses they needed in the moment. She said, I was terrified every single moment that I was there. And she said, I felt like I was alone. And she said, I will never do that again. And her story stayed with me. And so as I was sitting down to write my report this year, and a lot of people ask me, how do you get topics to write on? And it's a response from conversations like that. It's talking to other nurse leaders around the world. It's talking to nurses who are caring for patients in very trying times and pulling all that together and saying, these are the top of mind topics. This is what we need to talk about. And more than a year after this pandemic has surged around the globe, the World Health Organization has extended the Year of the Nurse from 2020 to 2021, and in recognition of the increased visibility of nurses and our contribution to the health and well-being of our world, our nations. Nurse leaders have always focused on providing resources while creating safe and effective workspaces, and the pandemic has sometimes rearranged those priorities and challenged the safe environment. And on nursing forums like this, nurses describe an absence of resources, infrastructure, and policies. They talk about a continued lack of PPE or staffing or support for mental health and the stress and the time. They are concerned about infection control practices related to lack of proper PPE and much, much more. Next slide. So the American Hospital Association, which I'm sure some of you are very familiar with, it is really an organization that looks at the environment of healthcare and creates policies for hospitals. Nurse leaders have cited the top challenges during the pandemic as communicating and implementing changing policies, because they have changed quite rapidly, and getting that to the caregivers at the bedside, surge staffing, training, and reallocating staff. When we were closing down theaters, we had to move staff around the hospitals, and sometimes areas where they were quite proficient, such as in theater, suddenly they're working in med-surg or ICU and they're not quite as proficient. And so it was creating an abnormal amount of stress for the staff, which led to emotional health and well-being issues and access to PPE and other supplies. So as we look at this, and nurses are embracing the mantra of never again, and consider whether they're going to continue working in healthcare, we have to listen and we have to pay attention to what's happening out there, and we have to provide resources. We have to be sensitive, and I know it's overwhelming. When you're the person responsible for staffing, I know it's overwhelming to have to receive this kind of feedback, but we have to protect this resource because it will not always be here. Next slide. So first thing we have to do is address the work environment. Effective communication is the primary foundation, because of course, working for Vocera, I work in communication and providing communication solutions. So I've had nurse executives call me and say, Rhonda, I just want you to know that communication was the foundation of everything we had to do, with the staff so cut off, covered in PPE, our inability to group as we used to, and having to do everything remotely. And so the World Health Organization, when we talk about the stress and strain of this work environment, the World Health Organization says that burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. Now, all of us are experiencing some degree of that. You know, we've all been living in this virtual world, and that's created its own kind of stresses. But let me just say this. When we talk about burnout, and one of my colleagues actually in the UK said to me, I feel like we use the term burnout because we don't know what else to call it. It's just an overused term, and it just really means something is terribly wrong and we don't know what to do about it. and I do agree that we have used it a lot. A publication just recently published an article talking about shifting the focus from the individual experiencing the burnout to what needs to change in the work environment. So if you sit down and think about, you know, we're having all of these discussions on resilience, you know, creating resilient staff, how to avoid burnout, helping people learn to cope. And you know, if we change our thinking to say, why do we need to have these uber resilient people when it is the environment that's causing the stress? It's the environment that's causing the burnout. So what can we fix in the environment? Stop blaming the individuals and blame what's happening to cause it. You can allow nurses to go away for 5 minutes of mindfulness every hour. You can create mental safe spaces. You can have protocols where teams surround an individual who's experiencing a high level of stress in the moment. But that lasts for the moment. If they return to that chaotic environment, it becomes unsustainable. You can't sustain all of that. So my daughter is a nurse as well, and she was saying that the hospital had to invoke the Safe Harbor Act over the weekend in the emergency department. And she said, and then people started bringing food. We couldn't even eat the food. We were so busy. We couldn't, it would just sit there and congealed. And she said, I was very frustrated by the fact that we want real solutions. We don't want more pizza. We don't want more sandwiches. We don't want any more of that. We want people to focus on the work environment and help us. We know that staffing is an issue. Maybe the solution is not more people. It's a more cohesive and functional work environment. Much of my work on cognitive burden has been on nurse acceptance of technology at the bedside and easing the burden of workflow. Using technology solutions in place of more people. We use technology in our personal lives, yet we expect nurses when they go into the hospital to surrender that, to put that away in their pockets. A nurse can sit in the car park and pay their child care people on an application on their phone. They can schedule dinner reservations, they can buy movie tickets, they can coordinate with the family who's got child care after school, all of that. But we expect them to put all of that convenience into their pocket, walk into the hospital, use pagers with one-way communication, use landline phones with the whole page and wait, the chaos of the environment. And even in some situations, I dare say, because they're hospitals and we have it all over the world, there's still fax machines, which were obsolete when most of these nurses were born. So we haven't moved forward in accepting, and frequently we look at going digital as just putting the patient health record into a digital format. But there is so much more to it, and connecting the teams. There is a repository of information, and then there is urgent right now communication, which when I talk to nurses, they will tell me, the number one thing that congests and confuses my day is looking for people. Who do I call? What's the right number to call? Where are they? How do I find them? And of course, now with COVID and everyone suited up in PPE, it makes it even harder for them to function in that environment. So we're going to talk about keeping nurses protected and safe, empowering nurses with control over family education, reducing the stress of crisis care, and enabling smooth movement from novice to expert, and protecting nurses from workplace environment, which is a huge conversation. Next slide. So Steve, we're going to go to the first poll questions.
Fantastic. Okay, so that's come up on the screen, hopefully for everybody. And the question is, what risk factors are currently impacting the safety and well-being of your nurses and other care team members? So we've got, how many options we've got? We've got 6 there, and we're going to select all that apply. So A is nursing shortages, B is COVID-19, C is inefficient care team communication, D, too many alerts and alarms interrupting work there, E is cognitive overload, and F, none of these factors impact safety and well-being. So what we'd like you to do, as I said at the beginning, is post all the ones that apply into the chat function, and we will do some analysis and come up with what look like the most popular reasons. So please engage and tell us what you think. Okay, so I think what we're going to do while you all carry on getting your answers in there, what we'll do is we'll ask Rhonda to carry on with her presentation, and we'll come back to the answer in the Q&A, I think.
Okay, Perfect.
Let me look.
Thanks.
Oh, we seem to have got we got an initial response. Yeah. So yeah, it looks like essentially everyone's saying so far that most things are relevant apart from F, as you might expect. But we'll come back. We'll come back to that. But essentially, people are saying all apply, which I'm sure is not a huge surprise to Rhonda and all of us. Anyway, back to Rhonda.
Okay, thank you, Steve. Next slide. So these are the 6 strategies we're going to talk about, and I'll just move on to the next slide. The first one is keeping nurses protected and safe, and I really address this by providing them with the tools they need to do the fundamentals of the job. One nurse said to me, the hard part about wanting to be a nurse is that you walk into a patient's room every day and you want to provide excellent care with every interaction. When there's a barrier to that, it's crushing to your practice. We're assigned to work in unfamiliar units with patients who are outside of expertise without any training, and we're lost. We need to address the mental fatigue and moral injury this pandemic has brought upon our healthcare workers. It's helpful to give people a safe place to go. As I said before, it's helpful to provide them support in this chaotic environment that we have. You know, I always describe healthcare as really following chaos theory, which basically says that everything around it is in motion and unpredictable, but there is a thread of organization that goes through that chaos that is predictable about the chaos. And that's truly how hospitals function. We can't always predict what's happening, what's going on in the environment, but there is a thread of predictability of this is how our day operates. So in looking at that, I always say, can we please be innovative? And when I talk about innovative thinking, it's not just innovative thinking about technology or digital or any of that. It's being innovative in how we think about staffing, being innovative in how we think about delivering care. And I do believe that we're coming into an era of healthcare where we're going to have to figure out the way to care for the most amount of people with the least amount of people. And the way you do that is to create systems and processes and technologies and AI, all of these things that we need to do that can support the clinician who is mobile. The first thing that we have to abandon is assuming that clinicians are stationary. They are not. There is nothing about mobile technology that is mobile except the user. And so we have to equip the clinician who is on the move with the information they need in the moment that they need it, wherever they need it, and the kind of information they need to keep them moving. Just protect their practice by equipping them with the tools they need to do the fundamentals of the job, finding people, finding resources, etc. Nobody should feel as if they're on an island, and nobody should feel alone and unsafe. We must protect the nurses. Next slide. One of the phenomena that came out of this last year and a half or 2 years was the patient-family communication dynamic. You know, we're not allowing family to come in and stay with the patient for obvious reasons. But it caused nurses to be fielding phone calls from family members all day long. And if the patient had a large family, there could be dozens and dozens of phone calls checking on their loved one. And when people are separated, families are separated, it creates a heightened anxiety that can drive more phone calls. So I suggest you allow nurses to have control over that communication. And technology is the perfect way to do that, because nurses can make rounds on their patients and notify many members of the family with a single application to say, I'll be giving you an update when I round, I'll give you an update when the physician makes their rounds, and then the consultant's information from there, or when I come back at noon, or to be able to say, you know, your loved one has been extubated. All of these kinds of pieces of information that the nurse can control, but yet communicate to the family. This is all going to come out to all of you at the same time via an app that everyone knows what to expect, and gives that power back to the nurses so they're not overwhelmed with anxious families and anxious responses that congest their day. Next slide. So let's talk about enabling smooth movement from novice to expert. Early in the pandemic, hospital leaders discovered that they had to rapidly change protocols and workflows, get innovative solutions, and move staff around the hospital. For some theater, when theaters closed, those nurses went on a furlough, but some did not have the financial capability to do that. They needed to keep working, so they were working in areas that were not always familiar to them. So when they work in these areas where they have an increased cognitive load, I've spent probably the last 3 years talking about cognitive burden, researching that, publishing on the topic of cognitive burden, which is basically how the short-term memory works. It lasts 8 to 60 seconds. It's where we make decisions in the moment. Long-term memory is where expertise is stored. Long-term memory is the expert. I don't really have to think about these motions because it's muscle memory. But in short-term memory, that can get overloaded very, very quickly, and it's when we're working in the unfamiliar. And my favorite example, which might mean something to you, is when I've been driving for a very long time, and when I drive a car in the United States, I'm very comfortable with it. You know, I can have my iTunes on. Sometimes I can carry on a conversation. I can listen to the nice lady in my phone directing me wherever I need to go, and I'm not stressed by it at all. When I come to your country, when I come to the UK and I'm driving on the opposite side of the road, that's not muscle memory. And in fact, I'm having to think hard to not do what I normally do. So my short-term memory and my cognitive burden is excessively high. I don't listen to iTunes. I don't carry on conversations. And the lady talking to me can sometimes be very stressful because I'm thinking, oh my goodness, I have to stay to the left. And so that is when we ask clinicians to move between areas, that's what we do to them. And it's extremely fatiguing. If you've ever driven in my country and you get out of the car and you think, oh, I'm just glad I got there. I'm glad this is over, because that's really the way I feel. I'll pull into a car park and I'll think, oh, I'm glad I got here. And so I see nurses all the time moving back and forth between being an expert where they normally work and then suddenly they're a novice. The stress of that is incredible. So use technology. Use reminders that can support their practice when they're moving into that novice space that can be so stressful. Push information to them via mobile phones that equip them to not have to go back and forth to the desk. Make it where they don't have to know names or numbers. They can just call by roll. They can call a respiratory therapist, and whoever is on call can respond to that. That's how technology supports and carries that burden of memory and carries that burden of knowledge, so that nurses who are working in unfamiliar environments can remain safe and functional. Next slide. I will say that fundamentally the unfamiliar is the enemy in a crisis. And so when folks are unfamiliar with environments, they're unfamiliar with responses, that can be incredibly stressful, and it can wear nurses until they are unable to function properly and make mistakes. The problem with excessive cognitive burden is that is the space where mistakes are made. And it is the space where frustration, burnout, and eventually people saying, I won't ever do this again, and they leave the profession, which is heartbreaking. So let's talk about workplace violence. We are in an epidemic of workplace violence for nurses. The pandemic has intensified the situation. According to the International Committee of the Red Cross, more than 600 incidents of violence and aggression related to COVID-19 were recorded against healthcare workers just from February to July in 2020. It's a complex issue to solve in healthcare, but it's one that has to be aggressively addressed. And I would suggest to you there are three components: culture, policies and protocols, and technology tools that enable instant communication and response. When I speak with large groups of nurses who've experienced workplace violence, I hear this uncomfortable and widely acknowledged sentiment, and that is a culture of looking the other way or expecting nurses to just cope with violence, and it has been allowed to continue, and this is unacceptable. There is no other profession, none, asked to consider workplace violence as just part of a job. Nurse leaders have to boldly call out, confront, and resolve all manner of violence in the workplace, whether that is lateral violence between the healthcare workers or violence between patients and families to the healthcare worker. When a nurse is injured, there must be proper physical and emotional support from all levels in the organization. There should never be any implication or intimation that this is to be expected. We just have to accept it. That's your patient. You need to take care of them. Everyone has a policy or protocol to follow when a patient becomes violent. Everybody does. But I would submit to you that if protocols were enough, the problem would be solved. It is not solved. It is increasing. We continue to grapple with how to prevent or stop violent acts and how to get help to the nurse in crisis in just a matter of seconds, because when you have a violent patient or a violent situation going on, seconds matter. Every second matters. So equipping with the nurses with wearable devices that allow them to summon for urgent help immediately with a panic button, rather than nurses having to pull a cord on a wall or press a button on a bed or just shout for help. We have to enable them to function in that moment. And as part of a multidisciplinary approach to violence prevention, they have to be able to summon help in the moment of threat. We have at Vocera created such a thing with feedback from the nurses. We tested with nurses and they said it needs to be here and it needs to do this and it needs to feel like that. And so we were able to create a panic feature that allows nurses to summon help without alerting the perpetrator who is escalating toward violence. We have done so many things in nursing to improve the care of our patients. And one of those things was, many years ago, medication errors were a very punitive act. It was something that the nurse was punished for. There wasn't good dialogue. It wasn't a learning experience. It was a very negative experience. So nurses became reluctant to report. They would try to smooth the situation or not always give the details because they so dreaded the outcome. We need to do the same thing with workplace violence. What happened was we started looking at it and we said, this punitive approach is not doing anything for the patient. It's not doing anything for the profession. So let's treat it as a learning experience. Let's treat it as remedial education rather than punishment. And so when a medication error was made and it was reported, the nurse had an opportunity to correct and to learn to prevent it ever happening again. So we know the fundamentals of how to change a critical problem. We need to do the same with workplace violence. We need to come together and we need to admit where it comes from. We need to aggressively address it, and rather than reports of violence being dismissed or being looked at as something that just goes with the job, we must reject that. We must create methodologies that would allow us to create groups of understanding and protocols and policies and technologies we need to protect the nurses wherever they are. Next slide. So what I've been doing over the last year is trying to understand what is the task load of communication. I mean, how are we managing that, and how does it add to the nurses' workload? So I do assessments in hospitals. I have nurses who do assessments to help hospitals understand how communication affects their consultants, their nurses, their ancillary staff, allied health, all of these groups. And the number one thing that always shows up on these assessments that nurses talk about is the inability to find the right people at the right time. The second thing they talk about is how much time they spend wasted just paging and waiting, using bleeps and waiting and sending out one-way communication and waiting, and how it congests and confuses their day. So hospital leaders need nurses to be able to focus on doing the work that needs to be done. We read of clinicians who are more afraid of decisions being made than actually taking care of patients with a deadly virus because they just dread what they have to face and work through. So rather than backing away from that very uncomfortable feedback, which is very uncomfortable, I will admit I felt uncomfortable receiving that feedback. We have to walk into the storm and have conversations, ask for feedback, meet the staff halfway when possible, and address the work environment. At every single CNO roundtable I attend, I meet nurse leaders who are perplexed and frustrated over how to fix what's wrong, and they're experiencing everything their staff is experiencing and more, and they're asking for workable solutions. So with the notion, or accepting the notion, that communication is the underpinning of everything that happens in a hospital, and based on data and feedback, I believe that we can solve a lot of these issues. And so I am opening this up. I have to say, I have opened it up to several organizations, and I've received replies from New Zealand, from Australia, and I would love to get responses from the UK or anyone who is listening. But we're going to look at, next slide, I think I have one more slide here. Well, no, go back. We're going to look at how we measure nurse communication in hospitals using the NASA Task Load Index. It has been used to measure the task load of workers in high intensity jobs like air traffic controllers or pilots or astronauts. NASA is our space program in the United States. A delightful man named Matt gave me permission to use this tool. And what we're doing is we're asking nurses to think back on the last shift that they worked, think about an incident of communication on that shift, and how difficult it was. And we're asking the 7 questions in the task load index. We're asking the 7 questions then to answer those related to that incident. So I'll talk about that just a little bit more. Let's go to the second poll question, Steve.
Oh, very exciting to have NASA mentioned there. Anyway, so our second poll question is, how do you protect the physical safety and psychological well-being of your care teams? So like the last poll, it's select all that apply. So pop the letter that you think applies, essentially. So the first one is A, which is make sure there are enough nurses to cover each shift. B, equip our care team members with wearable panic buttons. C, workplace violence training and protocols are in place already. D, simplified clinical communication and workflows. And E, need to do more to protect the safety and well-being of staff. So I think I got C slightly wrong there. It means, I think, basically to make sure that workplace violence training and protocols are in place. So the question again was, how do you protect the physical safety and psychological well-being of your care teams? So once again, like last time, I'll leave you to all get your answers in, and we'll hand back to Rhonda to carry on.
Perfect. Next slide, please. So my copy of my 2021 CNO report is available. You can just go to vocera.com and you'll be able to download that report. And there's more information about the NASA study, but let's go to the next slide and I'll show you what it looks like. Okay, this is what it looks like. It's asking think about the last communication event that you had. What was the mental demand from very low to very high? What was the physical demand? What was the temporal demand, or how much pressure did you feel? What was the effort, or how hard did you have to work? how successful did you feel in accomplishing the goals of the task, the performance, and then the frustration level? It's just the 7 questions. It's in SurveyMonkey. It is completely secure. No one has to give any identifying information. So if you have staff who are interested, I can actually, if you will contact me at Vocera, you can actually get results of your own individual hospital. If you're interested in doing that, I'm perfectly happy to segregate the data and provide that to you as your own individual hospital. But I think we're going to have a really fantastic global look at how nurses view communication in the hospital. And I think that using this tool that has already been tested, it's been used one other time in healthcare to measure work task load in an ICU. So this is only the 2nd time that we will be able to use it in healthcare. And I have to say that NASA was very enthusiastic about being able to measure healthcare communication load because it is just as critical as, say, an air traffic controller trying to land an airplane. It can be a matter of life and death to get communication proper in a hospital and get it urgently needed, when it's needed, and the way that it's needed, using the device that is needed. Next slide. So I would love to hear your voice. I would love to hear from you. Let's open it up for questions, and I'll try to answer anything you want to throw at me. And Steve, I'll just turn it over to you to sort of navigate this portion.
Perfect. Okay, so thank you very much, Rhonda. A fascinating presentation, which I'm sure our audience will hugely relate to. I just wanted to point out that I can personally relate to your experience of driving on the other side of the road. Now, as I said at the beginning, and as Rhonda has just highlighted also, we've got time for questions, so please get them coming in. This is a great opportunity for discussion. While you're all typing, I'm just going to quickly recap on our poll questions from earlier. So thank you very much for everyone who took part. So the first poll was that we asked you what risk factors are currently impacting the safety and well-being of your nurses and other care team members, and we were asking you to select all that apply, and the response was that A, B and C were the most popular responses, but C came out on top. So that was inefficient care team communication. I think E was the next most popular, I've been told as well. Anyway, okay, so I think we're flipping through to the second poll. So this one asked, how do you protect the physical safety and psychological well-being of your care teams? And the answer from you on that was fairly well spread, actually, but I think the main one, the most popular answer was E, which is need to do more to protect the safety and well-being of staff, which I suspect is probably not a huge surprise. Okay, right, so now, as I said, we've got time for questions, so please get them coming in and I'll ask them on your behalf. But I'd like to kick off myself. So essentially, I'm just going to start asking a few questions, Rhonda, and I'm sure we'll be fine. So I'd like to start off by asking you what prompted you to start writing these reports in the first place. You know, they're not a small undertaking. Was there a particular trigger?
Yeah, and you know, it's not a small undertaking, and as you know, getting content, I mean, that's your job. Providing significant content is an ongoing challenge. And so about 5 years ago, we were starting to see moving to digital platforms. So we were seeing such a reluctance among nurses, and of course, I'm a clinical informaticist at heart, you know, and I have been a nurse executive in a very large hospital in the United States. So I had that combination experience, and someone said to me, you know, Rhonda, you should write about that. You should write about what your responsibility as a nurse executive is in making decisions about technology and digital footprint in a hospital. And that was actually my first report, was writing on that topic. And it was so well received that the next year, we decided that we would just launch it during Nurses Week around the world for International Nurses Day. And the next year I sort of expanded on that topic, and then it just sort of grew from there. And now I have to be honest with you, I'm already working on next year's release. So, I mean, the topics have become bigger and more dense, and, I get more feedback, and I get people saying you should write about this. And so it's sort of turned into a year-long effort to make sure I'm writing relevant information.
Brilliant. I was going to ask you later on whether you'd got the next report underway, and it sounds like you have. So there we go. But we may come back to that later if we've got time. Right. So first question, and it's from Roger. And the question is, how do we best address the growing incidence and the increasing reports of stigmatization of the Asian nursing community and Asian-looking nurses due to the origins of the COVID virus? So yeah, that's a very concerning area.
Yes, that is definitely something that we are addressing as well, and thank you for that. I think that the challenge for all of us to remain aware of our diversity and integration biases is key. But I also think that sometimes we need to use education, we need to use our resources to actively re-educate and actively involve nurses of all different backgrounds and cultures and descent. And I would say, use your Asian nurses, your authorities on their culture to be able to educate broadly to the community and create opportunities for that forum and that conversation. We don't solve anything in the dark. We have to solve for problems with full transparency and conversation and openness. And I just want to say that I find it horrific how the roads we have taken and marginalizing people and communities in a time of such great stress for our world.
Yeah, I completely second all of that. Absolutely. Right, okay, so on to a question from Kirsty. And Kirsty wants to know, can anyone use the NASA Task Load Index tool?
You can. You just request permission from, as far as from me, you certainly can. We can make it available to you. I ask one question: if you're a registered nurse or a nurse practitioner, I do ask what your background is, but certainly you can use that. And all you have to do is reach out to me at rhonda.collins@vocera.com, and we can send you the letter that identifies the study. We can give you the link to the study. I also have written a letter that you can send out to your staff that would explain it to your staff and get them to participate in that as well. If you're wanting a more customized look at it, if you're wanting to say just get information for your particular hospital, we would need to have a conversation, but I can, because I'm using a standardized survey tool, I can use the data and actually screen the data to just give you your information, or you can go into the global database as well.
Right, that sounds excellent and pretty straightforward. Fantastic. Right, what else should we ask about? I've got some more questions up my sleeve. So your point about the size of the nursing workforce was poignant, I thought. Lots of countries report shortages, and there's a finite number of nurses in the world. So despite it being an incredibly internationally mobile workforce, essentially, I mean, would it be fair to say that there are only so many nurses to go round?
Absolutely. We are expecting World Health Organization and other entities are predicting a shortage of 11 million nurses worldwide over the next decade. We're not educating as many as are leaving, and the highest attrition right now of nurses is 1 to 2 years of experience. Those are the nurses that are leaving the profession or those who are retiring. So we urgently have to address the work environment. And so, nurses that were close to retirement when the second or third wave of COVID hit, they were saying, I'm not hanging around for another round of this, I'm going to retire. So we've seen quite an attrition there. But more concerning, actually, it's all concerning, but more concerning are nurses who have less than 2 years of experience who are saying, I'm not doing this anymore. This is not good for me. It's not good for my family. I had one nurse say to me, she said, I have never thought that going to work every night would make it where I would wonder if I would come home to my family the next day. And she said, I go to work every night thinking, is this the night that something's going to happen to me that I won't make it home? And she said, over time, the stress has just become unbearable, and I've had to look for a profession. So I would say that we have to critically address the work environment, number one. I think so.
Yeah, absolutely. Yes, retention. Retention is such an important part as well as recruitment.
Yes.
Yeah. So, of course, you mentioned workplace violence, which obviously is a very provokes very strong emotions. It seems to be a problem that doesn't really go away. Likewise, on a similar line, Nursing Times, we did a survey on sexual harassment at work, which is obviously again another difficult topic. We found that 3 in every 5 nurses have been reported being sexually harassed at work, either by a patient or a colleague. Is this a problem that you've noticed as well, and something that we need to take the same approach as that we would for violence in general?
Absolutely. I haven't seen that particular report, but when I speak about lateral violence, I will say in my conversations just over the last few months about workplace violence, it's the issue is that the lateral violence has increased over the last couple of years. And that means nurses and consultants, or nurses to nurses, being aggressive toward each other, or the harassment of each other, not accepting of the situations that are happening, or ridiculing when a nurse reports workplace violence. Saying, "Oh, come on, I've had worse than that happen to me." I think a lot of it is our own making in the culture of accepting, etc. So, Steve, are you still there? Steve is freezing a little bit. We're having some technical difficulties.
Yeah, I'm still there. Yes. Yeah, it's a few. It seems to be clearing up, but I can hear you, so that's good news. Yes, so obviously communication and improving it is obviously something, a subject that's very close to your heart. As you mentioned, pages and fax machines, which I unfortunately can remember. But also, I suppose the pandemic itself, although terrible and utterly horrible thing that it has been, has in fact managed to speed up the adoption of technology in some ways. So I suppose what's your message for employers and providers in terms of getting staff buy-in? Because you mentioned giving nurses control at one point. Is that the key for you?
It is, and the other is not requiring nurses to carry everything that they need to know or do in their memory, or go back to a stationary place to get the information that they need. I think that, and I also think that it's critical that we understand the role of the electronic health record, or the electronic patient record. It is a repository of information, but it is not an urgent right now communication tool. It's not designed that way. It's not even, it cannot function that way. And so what really keeps teams mobile, and what are mobile, I should say, and what keeps teams functioning together is that ability to have urgent communication in the moment when they need it, and to communicate urgent lab values, to communicate urgent need for a consultant or for a coworker, or to transfer patients. We were just having a conversation yesterday actually about we had a consultant give us some information on communication in hospitals. And they said, again, the number one issue is trying to relay information at change of shift or transferring the patient. And that's information that can't sit inside the electronic health record. It just can't sit there. You know, it waits for you to come back to it. So what I'm saying is to streamline what you do, enable nurses with wearable technology that allows them to communicate by voice that they can wear under their PPE. You know, they can just wake it up and they can say, hey, Vocera, and then they can say, call the consultant on call, call the cardiologist on call. All of those things, those are how we empower people to act in the moment and work as they need to work. I think we lost Steve. So Melissa, do you want me to continue? Can someone else ask the questions because I can't see them? Who has the question? I'm sorry, guys. Someone's going to have to read the questions because I can't see them.
Hi, Rhonda. I can jump in. So one of the questions that came in was a wearable device may get damaged and or be pressed, deployed often from being touched, bumped into accidentally. Can you comment on that at all?
Yeah, you know, we designed that again with nursing feedback, and the button is placed to the side. It's where the nurse is trained to access it. It's not a big red button on the front of their body that can be easily bumped or easily activated, etc. But it allows them to have control. And what it does is when the nurse presses the button, it opens up the microphone so everyone can hear the conversation. If you're working in behavioral health, you know, you don't want to say anything to exacerbate the situation. So that is a critical component of it, that we're protecting the nurse by allowing that information to be heard in real time. And so I understand concerns about technology, but you can equate it to a cord can be broken when it's pulled on the wall, or the button doesn't work on the bed, or you shout and nobody can hear you. So what we're trying to do is ensure that with nursing feedback and with design, we create something that allows nurses to manage that moment of duress.
Brilliant, brilliant. It's great when you get that feedback from the actual nurses. We kind of helps you make sure that we're moving in the right direction with this technology, doesn't it? So
it's really important that we have nurses help us design that. So we're very happy with that.
Brilliant. One of the other questions that came across was, we've done a huge amount of work in mental health services in the UK to tackle workplace violence. A lot of the time it requires staff and services to work with patients and carers to change the culture. But with the lack of resources, staff and support from the government, and including poor morale and pay, is this becoming an even bigger challenge?
Yeah. Is that a question or a statement? Did I lose you too, Oliver?
It looks like it was a bit more of a statement, doesn't it? But have you got any more that you can kind of add to that, and your thoughts across on that?
You know, just like anything else, I mean, when funding starts to dry up, or when the conversation starts to get stale, but the problem isn't solved, then we have to look at a more innovative way to approach it. And I realize that the drive to constantly innovate in our thinking it can be quite exhausting and quite frustrating. But I live by the mantra, if I've said it 10 times, I need to say it 50 times. If I've said it 50 times, I need to say it 100 times. And so we constantly have to repackage urgent information in a way that people can hear it. And so I would say that, you know, my work on cognitive burden, I feel like I woke up at the beginning of the year this year and I said, I'm tired of talking about this. I've talked about it for several years now, but I don't think people are interested. But 2 days later, my phone started ringing. People were saying, I have to talk about this. We have a huge issue with cognitive overload related to technology adoption. And can you talk about this again? And I realized that I said it 100 times, but now I needed to say it 1,000 times. And so I would say to you with these exact same kinds of issues that I believe that mental health is our next pandemic, without a doubt. That we have to prepare now, that we have to start looking forward to care for people who have really gone into crisis, from the isolation, from the illnesses and the separation and all of these things. So I would just challenge you. I know it's hard. I agree with your statement, but we need to say it again, and we need to keep it front and center, and don't take your foot off the gas. keep moving that forward.
Brilliant. Thank you, Rhonda. And I think that's time for now, but thank you everyone that's contributed with a question, a view, or to the polls that we've had today. But a very, very big thank you to Rhonda for her presentation, and to Vocera for supporting this event. So again, thank you everyone for joining. Yeah, we hope to see you all again soon.
Thank you so much.